So today we're going to be talking about what your child should be doing between the ages of 7 to 12 months. And like Lindsay said, at the end, we'll do some questions. But it's just important to remember that these are just guidelines. They're not hard limits that your child must do this at this specific time, but more of guidelines for you. The first thing that we'll talk about is safe sleep for all infants. According to the American Academy of Pediatrics, they recommend that babies should always sleep alone on their back and in a crib in order to reduce sudden infant death syndrome. So an easy way to remember that is ABC, alone, on their back, and in a crib. With the safe sleep program, they should sleep alone. So that means never sharing a bed. You can be in the same room. You can put the crib near the caregiver, but never in the same bed. And always remember to keep the room free of smoke, pollutants, and don't overheat or chill the room. The second part of the safe sleep program is to put them on their back. So anytime you're putting them down for a nap or go to sleep, making sure that we're putting them on their back. In order to prevent some flat spots on the back of the head, it might be beneficial to alternate which direction you're laying them down every day. So for example, maybe on the even days, you're putting the head towards the top of the crib, and the odd days, you're putting the head towards the bottom of the crib. And this just allows them to be able to rotate or turn their head both directions, because oftentimes they'll want to kind of turn towards the door to try to find you. So this will help prevent getting that flat spot on the back of their head. And then the third part of the safe sleep program is making sure that they're in a crib or bassinet. That should be a firm, flat surface, and the crib should be empty from blankets, pillows, toys, bumper pads, anything like that. And instead of using like blankets, making sure that you use a sleep sack instead, and making sure that the fitted sheet is very tight so it won't move around. Once the baby is starting to roll over by themselves, which is around like 4 to 7 months, it's safe to let them choose their sleeping position. But just remember, when you put them down for a nap or for sleep, that you place them on their back. But if they roll over, it's fine. They should be able to roll back over, and stop swaddling as soon as your baby shows any signs of trying to roll. And that can be even earlier than 4 months. That can be as early as 2 months, but just keep that in mind once they start to show signs of rolling, to make sure that those arms are free to be able to move properly on their belly if they do roll over. So the next part that we're going to talk about are gross motor skills, and that's what physical therapy focuses on. We talk about the whole body movement and different positions. So typically in babies, we'll look at their posture. We'll look at different positions that they might be in, whether that's their back, their belly, sitting, standing. We'll take a look at their body posture in all those positions. And then we look at how do they actively move their environment. This helps us look at their strength, their range of motion, or how well they're able to move, as well as their tone. And something else that we like to focus on is the symmetry of skills. We want to make sure that they're doing things both on the right side and the left side, and that we're not just favoring one side. And then also just making sure that we're achieving our gross motor milestones when we should be. Tummy time. So tummy time is a really important part of development. And tummy time is any time that they're placed on their tummy when they're awake and alert. So just like we talked about with safe sleep, we want to make sure that we put them on their belly when they're awake. And this doesn't have to be straight tummy time on the floor. You can see on the right that there's some other examples. That could be chest to chest with a caregiver. It can be inclined on a boppy pillow or towel, or even over a caregiver's lap. So there's different modifications that we can use in that. The goal for tummy time should be 60 minutes per day by 4 months of age. So up until that point, we're kind of slowly working up towards that hour. But by 4 months, we should be trying to get at least an hour a day. That doesn't mean that we have to put them down and they're on their bellies for that whole hour straight. We can definitely break that up into small pieces of time throughout the day. Find a time that they're most happy that to complete that, or if you're trying to get into a routine, trying to put them on their belly after diaper changes. And that's just a quick way, an easy way to remember to get that tummy time in. As they get older, their tummy time tolerance should increase as well. And tummy time is important because it will help develop motor skills that keeps them on track for meeting further milestones. It also helps strengthen their neck, their shoulders, their back, and it helps develop that flat spot on the back of their head. Since they're spending so much time on their back for naps and sleeping, we want to make sure that during their wake hours that they're getting into different positions for not only development, but also to help with the flatness that could happen if we spend too much time on the back of our head. Positioning devices, or sometimes they're often known as containers. On the right are just some examples of different containers. Ultimately, we want to try to put baby on the floor because floor time is going to be best. If we do have to use any of these containers or positioning devices, it's recommended no more than 15 to 20 minutes maximum a day of that. The reason why that we will want to promote floor time is it's going to help your baby reach their milestones on time. It's like we mentioned, it's a good core and arm and leg strengthening, and it also helps promote motor planning or trying to figure out how do I get from point A to point B, and encourages that independent mobility that we want. So what about jumpers and walkers? Well, some fun facts about jumping and standing. Children usually don't jump on their own until 2 years of age. So we have plenty of time for kids to work on that from the time they're walking up until 2. So right now we just want to focus on putting them in positions that's going to help their hips develop properly. So we want to try to not spend prolonged periods of time in standing until at least 7 months of age so that they can help those hips develop properly. And infant walkers are shown to actually delay independent walking rather than help it. If we do use any of these devices, again, we're encouraged to do 15 to 20 minutes once a day. If you are choosing to use them, we also encourage you to adjust any of the devices so that the feet are flat on the floor and not on the tiptoes. Some of the manufacturers will say that, you know, put it so their tiptoes are just on it, but we want to make sure that that foot is flat on the floor and they're pushing through their entire foot. And again, just promoting as much floor play as possible that allows them to move and explore and try to figure out how to do those gross motor skills on their own so that they can reach those milestones on time. The pictures on the left, you can see of a child not weight bearing through those legs or pushing through those legs. They're kind of just sitting in the devices or the containers. They're barely putting some of their tiptoes on the floor. Some of them are, but it just doesn't put our body into a great biomechanical alignment. And we want to make sure that that foot is nice and flat and they're actively pushing. So if you are going to use them, you can see on the right side, you see a child standing in a container and those feet are nice and flat. So they're actively engaging their body with that. The other pictures, you can see that they're doing some floor time, working on tummy time, trying to crawl and figure out how to move forward. You can also use furniture like couches to help encourage them pulling up to stand and standing with support at a couch rather than a positioning device, or even standing and walking with a push toy is a good idea too. So let's talk about gross motor milestones from 7 to 8 months. On their belly, you're going to start seeing kids push up onto their hands more. Those elbows are going to be extended or nice and straight. Kids will start to pivot or turn on their belly. We want to see them both going to their right side and their left side. We also will see them pushing up from their belly onto hands and knees and maybe rocking back and forth to prepare ourselves for crawling on hands and knees, and they'll be experimenting with that. And then we'll also might see a commando type crawl, which is on your belly and pulling yourself forward to play and try to get to toys and explore your environment. At 7 to 8 months, your child should be rolling pretty well from both belly to back and back to belly. And again, we want to make sure that they're going both directions, over the right side as well as over the left side with that. They're also sitting really well. Their body is nice and straight and in midline, typically using a ring sit position with our feet in front. They might try to do a little bit of side sit with our feet to the side, or a long sit with the feet out in front. But overall, their posture's upright and they're able to do it by themselves. They're also trying to experiment with transition. So they might be starting in a sitting position and then experimenting to try to get a toy outside of reach to get down onto their belly. This is usually not very controlled and almost looks like a fall, but as they practice and doing it more, it'll be more controlled, and they might even try to get into hands and knees and keep that position from a sitting position. At 7 to 8 months, you also might see them pulling to stand at a furniture using both their arms and their legs. So they're using their arms at the same time to pull up, but they're also pushing with their legs at the same time to pull up. And then at 9 to 10 months, we see even more movement, and we're building off those skills that we mastered between 7 to 8 months. So we start to crawl a lot better on our hands and knees. We're using both sides of our body, and we're able to start changing directions and really explore our environment. Our sitting has progressed even more. We're using a variety of different sitting positions because our core strength's getting better, and you will see them playing using both hands more versus trying to stabilize themselves with their hands in sitting. Their transitions are even progressing. You're seeing them move in and out of sitting to hands and knees more. They're getting stronger with that and moving faster, as well as pulling up into kneeling at a surface and standing. And then once they get into that standing position, they're starting to play. So they're starting to reach with a hand, which might lead to cruising or sidestepping around furniture to try to get closer to other toys. With the hands held by an adult, they start to take some steps, and we also see really good protective reaction. So in sitting, if they fall either to the side, forwards, backwards, we see themselves catching themselves with their hands versus just falling to the ground. So why is crawling important? Just like tummy time, crawling is a whole body strengthening workout. It strengthens our trunk, our hands, our arms, legs, shoulders, hips, but also it really helps strengthen the small muscles in our hands, which will help with grasping. It will help with eventually writing, getting dressed, and it helps develop the arch of the palm. So a lot of those small muscles will help with some of the fine motor activities that we'll go over here in a little bit. And this is kind of just the foundation of that. It also helps with developing binocular vision, which this involves training the eyes to look at one thing and then back at another. So in crawling, that would be child on hands and knees. They're looking across the room to get to a desired toy, and then they're looking back at their hands to crawl. In the long term, as we get older, this correlates to the school setting of your child is sitting and they have to copy something off the board and then look back down at their paper. And if a child doesn't crawl, that can be challenging for them because they haven't worked on that binocular vision. It can also help develop hand-eye coordination for ball skills such as catching and throwing. So it's really important not only for the strengthening aspect, but also for that vision and coordination. So we definitely don't want to skip the crawling. And then between 11 to 12 months, we continue again to build off of what we were doing in those earlier months. We're starting to pull to stand, but now we're doing it through a half kneel, which is on our knees with one knee back and the other foot forward, and really using our legs more so than just our arms. They're also walking really well along furniture. They're going both directions. And you may even see them stand in the middle of the room for a couple of seconds. So they're really working on that balance to be able to eventually walk by themselves. Instead of walking with two hands held, we're now able to help them walk with one hand. And they're standing, like I said, by themselves but it's usually with a wide base of support. So those feet are a litlittle bit wider. And as they get more balanced, you'll see that base kind of narrow a little bit, but it's not uncommon for those feet to be wide just to give them more stability. And then the fun part happens that they start to walk. The average age of independent walking is between 11 to 12 months, but that does range about 9 to 16 months. So what about W sitting? I think we've all kind of seen W sitting before. You can see in that picture of a child sitting on their bottom and their feet are behind them, almost in that W position. So why do kids do this? Well, it's a very stable position for kids. They don't have to use their core. They don't have to use their balance. They're able to use just the stability of that position and be able to use with their hands freely to play. So kids with low tone, decreased balance, too much mobility in their joints or hypotonia might choose this position just because it's easier for them. But there are some long term negative effects of W sitting. So too much time in this position can cause some orthopedic problems and delay development of core strength and stability. So if we're in this position too long or choose this position as our primary sitting position, it puts our hips in what's called internal rotation, which causes our toes and our leg to turn inward. And that results on tightening of the muscles on the inside and then loosening or stretches out the muscles on the outside. And that can lead to an in-toeing gait pattern or walking pattern or knock knees. And that can result in problems with balance and coordination, because now instead of walking with a typical alignment, we now have this internal rotation, and then we start tripping over our feet a little bit more. And so you might see a little bit more clumsiness and that decreased coordination because they really have to work to try to get those toes out. So what can we do? So we can help them get into a better position. And positions you can see there on their right could be crisscross applesauce, leg straight in front, or even a ring sit. The best thing to do is to physically help them get into that position, but also to give them consistent verbal reinforcement. So choose a phrase that works for you. It might be fix your legs, legs out, sit on your bottom. Whichever phrase you choose, I would recommend sticking with that and just consistently you helping them fix your feet, legs in front. And as you're doing it, you're giving them those verbal cues. And eventually the verbal cues will take place of the physical cues, and you're hopefully able to just give them the verbal cue of legs out, and they'll fix that sitting position. And make sure you praise your child when they reposition themselves, because W sitting can be a quick habit to form and a really hard habit to break. So if we help them correct it at an early age by physically helping them, and them eventually figuring out how to do it themselves, it can help prevent any of those negative postural outcomes that can occur from this position. So we'll talk a little bit about atypical development and when we should talk to your pediatrician to maybe get a referral to get an evaluation for physical therapy to see if there's anything that we can help with. So by 6 months, if your baby isn't completely or even trying to roll over from their back or to the belly, we should get that referral. You might see that they're really content and not really motivated to move from their back to belly. Another thing that for atypical development is if you notice them favoring one side. So if they're always looking to one side or always rolling over the left or always pivoting to their right, and they really struggle with doing things on the opposite side, that's a good reason to come in and see how we can help your child get that symmetrical skill and on track. Like we talked about with safe sleep, sometimes flatness on the back of the head can happen, which can lead, if that one side of our head is flat, it usually causes us to look one way, and that can cause some tightness and asymmetries of our neck muscles. So if we get them in early for that, we can definitely make a quicker recovery to symmetrical skills. Another reason that you might want to talk to your pediatrician is if you notice that your baby either feels really floppy or really stiff when you try to move them. So this could be with just general play, changing their diaper, getting them dressed. But if you feel any of that extra floppy or extra stiff with those things. And by 12 months, if your baby isn't getting onto hands and knees and trying to crawl yet, come see us. And then the last one, if they're not really putting a lot of weight through their feet when you're trying to stand them, as well as if by 7 to 8 months, they're not really sitting well and playing by themselves. So we'll now talk about a couple different things that your child might be struggling with and how we can help them with those challenges. So we already talked a little bit about W sitting, using those consistent verbal cues as well as physically helping them get into a better position and just promoting crisscross, sitting with our legs in front, side sitting. You can also encourage them like, this is your pillow to sit on, or this is your cushion. Sometimes just having them a little bit elevated can help as well, because it's hard to W sit on a different surface. If you notice that your child is having a hard time rolling, try helping them roll versus just laying them in one position. So say you put them on their back and you want to work on tummy time, instead of just lifting them and putting them on their belly, help them roll into that position, and vice versa. If they're on their belly, they're really upset and you want to get them off their belly, instead of just picking them up, try rolling them to their back first. And another way you can try is putting toys outside of their desired reach. So something that they really want, place it so they have to roll to get those toys. It's a similar concept with crawling. You can put toys that are outside of their reach to try to encourage them to move forward to get it. You can also help get them onto hands and knees. Encourage just that static hands and knees position with reaching with one hand can be helpful too. It works on that lateral weight shift that we'll need for eventually crawling on hands and knees. And then the last thing, if they're not pulling to stand or cruising, like sidestepping along furniture, try putting toys off the floor. Try putting them on the couch to see if they'll try to pull to stand, or put them across the couch. So once they're up and standing, we try to move the toys down the couch a little bit to see if they'll get that weight shift to be able to move to get those toys. So if you have any questions about the physical therapy, we can definitely get a referral and get your child in. But do you guys have any specific questions for me?
And also don't be afraid about the recording, because I talked to Brandy and she said she cuts out like the questions part. So that's not in the recording for people to stream later. It's just the therapist talking. I don't think I see anything in the chat. Okay, so if there's no questions or anything, we are going to get going on to, I think it's OTs next. Okay. All right. Can everybody see the OT part?
Yep.
Yep. Okay, I am going to give it over to Alyssa then.
All right. So, what exactly is occupational therapy? Occupational therapy helps promote engagement in daily occupations. Those occupations change as we get older. So, for babies, the main things that we're looking at are eating, sleeping, exploring the environment, and playing. So, for babies 7 to 12 months, some things that we consider is observing the child in a comfortable environment, home, watching how all body systems interact. So we're not just looking at the hands, we're looking at the hands and the movement of them, the eyes, and then how they're feeling and the sensory piece. Are they listening? Are they turning their heads when you guys talk? And we look at all these areas of development. So some of the main things that we look at in OT are sensory, fine motor, visual motor, which can also be eye-hand coordination, and self-care. The mainly self-care is the feeding aspect. So, what are sensory systems? We have five senses, and then there's more. The main ones that we look at are tactile, which is touch, vestibular, motion, auditory, hearing, and visual, which is vision. Some of the other systems is interoception, but we usually address that a little bit later when they're older when it comes to potty training. So, those are the five that we look at now. So, tactile, what we want you guys to do at this age is provide lots of opportunities to touch, to feel, to get messy. So, if you guys are it's summertime, let them walk around without shoes on. Give them opportunities to play in water, grass, leaves, finger painting. And as difficult as it sometimes is during mealtime, letting them get it on their hands and on their face. We also want to provide opportunities for motion, swinging, rolling, climbing, bouncing. So if you have them and you're holding them, giving them some swinging, letting them move around on the floor, rolling them. Um, and with that, when what we want to monitor when we're giving that input is if they're overly sensitive. If you're swinging your baby and rocking them, are they crying? Lack of reaction. Does it seem like you could swing them for hours and hours and hours and it doesn't change them? And then interest in environment. If they are touching everything, um, it's kind of to be expected, but we want to make sure that they're moving, they're looking, they want to know what's going on. So, fine motor skills. Think of that as what we do with our hands. For 7 and 8 month olds, we want them reaching, grasping, putting objects in their mouth. With that, you want to make sure that if they're playing, that they can't swallow anything that they shouldn't. We want them banging objects on surfaces, transferring objects hand to hand. An easy way you can work on that transfer is if the child has a toy in their right hand, give them another toy on that right side so that if they want to hold both, they have to switch to the left to grab that one on the right. For ages 9 to 10 months, we want them using a pincer grasp, which is the index and thumb. One way you can promote that is if they like Cheerios, pop those Cheerios in an ice tray. It kind of forces them to only use a few fingers to grab them. We want your babies holding their own sippy cup. We want to see control when they let go of objects. So instead of them just falling out of the hands, we want to see that they're purposefully letting go of the objects. We also want to see them taking out objects of containers. When you first introduce that, have it be a bigger opening for the container, and then as they get older, we can reduce the size of that opening. We want them clapping hands and banging toys together. So, doing a lot of modeling for that, clapping with them. Some other toys that are great for this age are nesting cups, ring stackers, pull apart toys. Those can really promote all of those skills. For 11 and 12-month olds, we want to see manipulation of blocks. You can start out with larger blocks before moving to smaller. There are some excellent magnetic blocks that I love using that can be fun for kids. We want them opening baby books. Think of thicker baby books at this time, and you can address the sensory aspect by getting the tactile books where they have to feel different um, tactile input. You can also do the Pop It books, which is great for developing the finger isolation. We want them taking objects out of the container and putting in, so think a little smaller of an opening at this point, and then turning their forearms over. So we want them to be able to do that. So if you give them something, try to wait them out to see if they'll put their hand up. When to seek help for these fine motor skills. If your child's not bringing their hands to the middle of their body and using those hands together, if they aren't holding on to objects when they're playing, if you see no interest in using arms, or if you see significant use of one arm over the other, at this point we want them using their hands pretty equally. So if you see your child only using one hand, that would be a time to seek help. And again, like Miss Kristen said, if your muscles in the arms feel tight or really loose, that would be a good idea to talk to your pediatrician. So, the main self care that we look at for this age is feeding. So 7 to 8 months, we want the baby holding their bottle independently. 9 to 10 months, we start seeing finger foods for soft foods like cereal. You can start drinking from a cup, and you'll see lots of drooling at this time. It's also when they're getting a lot of teeth for that drooling. 11 to 12 months, they'll begin just continue finger feeding. They'll take bites and chews out of solid food, and they may start removing their socks. And we're going to get more in depth on that feeding piece. We see a lot of kids this age start coming in for feeding. For 6 to 9 months, we're looking at them still using a bottle and introducing liquids and pureed foods. You can introduce a sippy cup at this point, and you'll start seeing your baby close their lips around the spoon. So at this time, we definitely want to stop the scraping off at the top lip, and we want to wait the child out if we're feeding them. So you provide the spoon and kind of wait for them to close their mouth around it. You begin more texturized foods around 7 to 8 months, and kids want to play more and interact during meal times. And as I said in the sensory part, I know sometimes it's difficult, but that's really something that we want babies to be able to do because it helps with a lot of different areas. Um, and around in between these two times, around 8 to 10 months, you can start introducing straw drinking. 9 to 11 months, soft foods, multiple mash table foods. This is also the time when we want to start kind of weaning away from the bottle, introducing the cup, sippy cup, and straw. You'll see improved munching and biting because they have more teeth. You'll see attempts to hold the items, sucking, biting it, and attempting to help with spoon. So at this point, even though you may be feeding them most of the food, it's a great time to give them a spoon to hold while you're feeding to get them in preparation to start beginning to feed themselves. You'll also see at this time easily distracted. They may be looking around the room. So if it's taking a long time to feed, you might want to limit those distractions. And then 12 months, they easy to chew foods. They're managing it very well. You can start introducing coarsely chopped foods. At this point, they can drink from an open cup, sippy cup, straw cup. They can finger feed themselves, and they're starting to dip their spoon. So don't expect them to do the full scooping like you are, but if they want to dip and bring it to their mouth, let them. It's a great opportunity. If you do want to start introducing cup drinking, there's a couple cups that I like to recommend. There's the reflow cup, which reduces the speed of the flow, but it's an open cup. There's a nosy cup, which has a cutout for the nose. So when they tilt, it makes it easier. And then you can find the little plastic cups at Target, which is not a lot. So if they spill it, it's no big deal. And I always recommend starting out with water with that open cup. So, with some tips for picky eaters, introduce a variety of foods. You want to provide those opportunities again and again and again. If you introduce bananas one day and your kid pushes them away, you want to introduce it again at a different time to give them that opportunity. Make sure you're trying different colors, textures, consistencies. So if you may be eating meats and everything, but you still want to give them the opportunity to eat yogurt, smooth foods, lumpy foods like cottage cheese. Again, encourage play with the food during that time and try as much as possible to eat dinners together. It's a great time to model chewing, eating, and it's good for the whole family. And then providing familiar family foods, and then giving them chewy toys, teething toys that have different textures. There's the ones with you put the fruits in the bag and they can get some juices with that and it allows them to chew. Um, there's a carrot that you can look up on Amazon that's great for how thick it is. And it provides them opportunities to chew and develop that and build endurance with chewing. There's also a phone app that I highly recommend. It's called Solid Starts, and it provides all these examples of food and it gives you an idea of how to present them, how big of bites you should do, what age you should present it, if there's any risk for choking. And it's just a really good resource to have when you start introducing those solids foods. So, when to seek more help with feeding. If you notice during mealtime your baby's in a poor position, which would be they're slumped forward, their chin is resting on their chest, that might be a good time to talk. If there's frequent choking, gagging, or if they're getting pneumonia very frequently, that could be a sign of silent aspiration. So, we'd want to get that checked out. If they're having trouble chewing, munching, which could look like they're holding food in their cheek, if they're holding it on for a long period of time, they may be having a difficult time chewing it, and we would want to see them. If they continue, you're presenting the same consistency over and over, and they're continuing to refuse it after, around that 1 year mark, it would be a good idea to come in. If you see extended meal time, so they are just always looking around or they just don't want to eat. Um, or again, it takes a long time for them to chew and finish their food. That would be a time to ask for a referral, or if they aren't gaining weight. And one thing I think for the feeding piece of it, it's better if you have any concerns to talk to your pediatrician when you have that concern instead of waiting. We want to make sure that they develop every skill that they need for feeding and that they're willing to eat all the different consistencies, um, so it doesn't progress when they're older. So if you have any worries, get a referral, we'll check it out and we can give you strategies or let you know what needs to be done. Alrighty, do you guys have any questions for occupational therapy? You can type it or unmute yourself and I can answer.
Hi. So my son is almost exactly 8 months old and he drinks from a sippy cup, but like lots come out of the corners of his mouth. Is that normal? Is he like drinking too much at one time? What are your thoughts on that?
It's tough to say because I haven't seen them. It could be a variety of things. It could be the flow is too fast, or it also could be he just doesn't have the best lip closure around the sippy cup, and would need to work on that. So you can try to try to find a sippy cup with smaller holes
Mhm.
and see if there's still the flow. And if there is still a lot of flow at that point, I would recommend an evaluation so it gets some strengthening around his lips for that.
Yeah, it seems almost like a choice. Like sometimes he drinks it and then sometimes he just like lets it fall out of his mouth. So that's what made me think it was more of a flow. But
Yeah, definitely try changing. And uh, it's tough because sippy cups, they don't spill as much. You can also try the straw if you can find a really thin one.
okay.
That could be a change and see how he manages that. But try to reduce the flow first and see if there's any difference.
Okay. Thank you.
Mhm.
Okay, if there's no other questions, we're gonna go on to Grayson with speech.
Okay, so we are going to start off with the hot topic of screen time. 64% of toddlers currently are watching TV and videos for over 2 hours a day. So we're seeing a lot of screen time. And 36% of children have a TV in their bedroom. Some other data, 1 in 3 kids are using tablets or smartphones before that they can talk. Preschool children spend an average of 4 hours a day using screen media. 8 to 10-year-olds are using it for nearly 8 hours a day, which is almost a full workday. And then teens spend more than 11 hours per day on screen media. It's a lot of time that we're seeing. So the American Association of Pediatrics actually recommends 0 minutes of screen time for children under 2. We want them to prioritize all this development that we've been talking about. So they recommend absolutely 0, but 29% of babies are watching TVs and videos on average of 90 minutes a day. So I know YouTube is easily accessible. Our phones are in a pocket, but we are encouraging to limit that screen time as much as possible down to 0 with children under 2. Again, it can undermine that learning, that development that we are trying to encourage. And I hear often in the clinic and with my parents that they found language videos, they found learning videos, and that's great. But in an ideal situation, we're encouraging natural development, face-to-face interactions, physical play with toys, as we talked about earlier, is the best that we are encouraging. If we can avoid those videos as much as we can, that's what we would encourage. As this says, there are a lot of negative side effects to screen time. Just a few of them is impacting our sleep. As we hear a lot of as adults, that blue light effect is keeping us awake. It's interrupting our circadian rhythm. We are not getting quality sleep. Same goes for our kiddos. It's impacting their sleep. Also, it is a factor in childhood obesity. As we touched on earlier, we want kids moving around. We want them outside playing. And when they are locked into a screen, they are often immobile. They are not moving. And it is a contributing factor in obesity. For these same purposes, it is also affecting mental health in reducing those play opportunities, hindering interaction with other people to then build these language skills, and can also impact their strength and their posture because, again, they are just locked into these videos and they are not moving their bodies and strengthening those muscles. It also impairs their attention and increases their impulsivity. So how exactly does this hinder language? As I touched on, we encourage that face-to-face interaction with caregivers. We want babies to see their parents, to see their loved ones, see other adults, see their face moving, see their facial reactions. And when we're looking at a screen, it's not the same as the real thing. It limits those opportunities for baby to actively listen. So it later touches on, we call this passive listening. They're attending, but they're not really. Similar to how you as an adult are on your phone with social media, you're listening, but maybe not all of the way. That's the same with these kiddos. And we want, again, that real interaction. We want them to hear your voice. We want them to hear you talking to them and providing that language modeling all of the time. One phrase that we use is you want to be your baby's narrator for life. We want to hear as much language as we can, just talk to them all of the time. And we're not really talking to them when they are watching a video. Another thing this touches on is digitally distracted parents. So one thing that we need to be mindful of is not just our kiddos reducing their screen time, but also us and us in front of them, especially. We want to be good models. But an interesting study showed that babies showed physical signs of distress, increased cortisol, increased heart rate when they were looking for their parent and they weren't able to lock eyes with their parent when that parent was distracted by his screen. It caused them physical distress. So that's something to be aware of. I know it's sad to think about, but making sure that parents are putting down their phones and then reducing that screen time for baby too. So for every hour that a child spends in front of the screen, if we have to, we like to say, let's do an hour of physical play. Outside, inside, whatever it be, just an hour away from that screen for every hour we got in front of that screen. Also, these same studies are showing that the larger the screen, the better. So a TV is ideal. Again, if we have to do that screen time, then iPad, and then phone is the least preferred screen. That's small, it's in their face. If we can get a big TV screen further away from their face, that is best if we have to do it. Again, this is more so for older children, for toddlers. We are recommending 0 screen time for children under 2. And again, I get the question almost every day of, what about Miss Rachel? What about these educational videos that are available on YouTube? These learning apps that are available on our phones? It's coming from a good place. But again, in a perfect world, we're recommending that real stuff, that physical stuff. But if we absolutely have to do screen time, I encourage my families to seek out low stimulation videos, low stimulation activities. We don't want very in your face, high stimulation, kind of like that CoComelon is just, there's a lot going on. We want to keep it low stimulation so we're not getting their bodies kind of amped up. I prefer a real face to a cartoon, again, so we can see that facial modeling, the movement of the mouth, the facial expressions, that eye contact, interaction. So Miss Rachel is great. She's actually a certified speech language pathologist. She has her, what we call the C's, the clinical certification of competence. So if we have to, that's what we're looking for. So speech and language, we're going to look at all of the different categories that we look at because our scope is pretty large. We're looking at speech, that's specifically the sounds that we are making with our mouth. So with children, the 7 to 12 month age range, it's looking at the cooing, the babbling that's happening, the sounds that they're making, like ba ba ba, da da da, and what all that sounds like. Language not only refers to the language that we are using, it is also referring to the language that we're understanding. So that's what we call receptive language, is the understanding of language. And then the expressive language is the language that we're using. And then social emotional skills. So how we're interacting with others, our pragmatic skills. This includes engaging with others, whether that's peers or adults, joint attention with others, greetings and farewells, and then play as well. So speech-wise, at this age range, they're starting to babble a little bit. We might see some what we call bilabial consonants, where we use both of our lips. So M, B, P, or getting into kind of behind the teeth, T or D. They may start to sound a little sing-songy. They're starting to mimic what we call the prosody, the pattern of our adult speech. So you might hear some intonation. Maybe it sounds raised, like they're asking a question, and they're kind of just playing with their voice, playing with those sounds, and starting to just explore their mouth and what those sounds feel like in their mouth. And then we might hear what we call reduplicative babbling. So that's the same sound over and over, that ba ba ba, ma ma ma, da da da. And like I said, they're just kind of playing with their voice there. It's fun to see. And then getting into our language skills that we're looking for. Receptive wise, we are looking for a baby to be responding to their name pretty consistently. So if you call it, if they are responding in some way, shape, or form, whether that's with their eyes, with their body, maybe with vocal engagement, like a little bit. They're looking for partially hidden objects. So that object permanence skill. They are phasing out of that baby stage of if something's hidden, then it no longer exists. Now they're understanding that if it's hidden away from them, that it still exists, and they'll go look for it if they see it and then it's hidden. They understand that it still exists, and then maybe they'll go look for it. They're starting to look at common objects and family members if you name them. If another family member is in the room and you name that family member, maybe they look towards them, or they look towards a toy in the room that you've named, like, oh, the bear, and they look towards it. They might start to understand no, and maybe stop for at least a little second, showing that they do understand. Whether they listen, who knows? And then they're starting to look at pictures when they're pointed to and named to. If you're reading a book, looking at a magazine, newspaper, pictures, what have you, they're starting to engage with those. And we're looking for them to engage for about 1 full minute when you're engaging with these things with them. In play, will they give you a block or toy? If you ask, hand out extended, give me the block, give me the ball. See if they'll follow those single step commands like that. And then other simple commands with bodily actions. Give me a high five. Show me your nose. Where's your belly button? Things like that. And then expressive language, they are starting to imitate our gross motor gestures, whether that's like waving, if you say up, raising our hands up, and imitating those actions that we do with our body. Gesture and vocalizing to indicate their wants and needs now. So they have more intentional requests versus the whining and crying that they did at that younger baby stage. They're being more intentional with saying, hey, I want this in some way, shape, or form. That can also be with reaching towards an object to request it. They're vocalizing a lot more. Again, that vocal play that we talked about during play or in the mirror. Oftentimes I see some kiddos are just more vocal to themselves. They like kind of exploring that vocal play when they're engaging in independent play. They get really, really chatty. They'll jabber pretty loudly. And again, with that play on prosody, that play on the pattern of the language, imitating our sing-songiness of language, and maybe including some intonations and inflections. And then we might start to see some true words at this age. It's not to say that if it's not happening yet, that's a red flag, but we might start to see it around this age. And it may or may not be a very clear word, but we like to say language is arbitrary. So if they're using a word, whether it's their own made up word in the same way every time, that counts. And then our social emotional skills. So as babies, they have the stranger danger of, if you're not a safe adult, if you're not a parent, then they might be hesitant to engage with that adult. That still might be present. We're also engaging in some peekaboo games, some social games of peekaboo, patty cake, things like that, where we have to engage with another person. Maybe we're banging some objects together and starting to engage in this cause effect play. So this is the idea that I do something and something then happens, whether that is a toy where you push a button and then something happens. We have, there's a toy with the 4 doors and there's the 4 different buttons that you push and then the animals pop up as you open those buttons. That's a good example of a cause effect toy. So you do something and then something that happens, and they can understand that relationship there. They're starting to engage in the turn taking games, maybe rolling a ball back and forth, maybe the peekaboo again, that turn taking a little bit. And then they still are maybe mouthing objects, and that is a-okay. Again, as Alyssa touched on, making sure that it's not a choking hazard for sure. And then maybe they're engaging their tongue more with the oral exploring of these toys. We're starting to see some waves of hi and bye, and then they're exhibiting joint intention. That is that eye contact, that shared enjoyment of an activity. They look at you, you look at them, and you're in this together. You're playing together. They're like, do you see this cool toy? Do you see what we're doing here? And they're engaging with you with their eyes. And then some atypical behaviors. And when should we start talking to our pediatrician, seeking out a speech therapy referral? If at this age, they're only making a few sounds, they're not maybe engaging in that vocal play that we've talked about. There's not a lot of babbling or cooing happening. If they're not using gestures, if they're not waving or pointing with one finger, whether that is to ask for something, to ask for help, or even just to show you something cool, pointing those things out. If they're not responding to their name consistently, or if they're not engaging in those social games that we talked about, like peekaboo or pat a cake, or engaging for that full minute with you with book reading, looking at pictures, things like that. At 6 to 12 months, if they're engaging in the poor eye contact, the lack of gestures, or not engaging in this play, then maybe we talk to our pediatrician. Also, if your child has been diagnosed with a congenital disability like hearing loss, Down syndrome, or something along those lines, those are often accompanied by a speech or language delay. So if you haven't already, that would be an important time to talk to your pediatrician about a speech therapy referral. So what can we do to help? Assessing their hearing is pretty important. Hearing is obviously closely tied with speech and language development. We have to hear the model for us to then develop, and for our babies to develop their speech and language skills. So did they pass their newborn hearing? Have they had a lot of ear infections? If they've had a lot of ear infections and they're not able to hear their environment, again, they're not hearing those models, they're not able to develop those skills. And then moving forward with that, talking to your pediatrician about that. Do we need a referral for an audiologist visit? Do we need another hearing screening just to make sure that everything's okay? Hearing is one of those tricky things, especially in kids this young that can't tell us that something's wrong. That can be pretty sneaky. And it's always just a good idea to check up on and make sure all is good. Playing with your child and exposing them to other children. So I always encourage my parents to engage in that floor time play. It's important, not just for PT like Kristen talked about, but for OT skills and speech and language skills. I want you to get on the floor with them if you can and get face to face with them again, showing them your mouth moving, showing them your facial expressions, modeling to them how we engage with these toys, and getting them to imitate some of your actions. If you maybe play with a toy in a silly way, seeing if they'll copy you. And then engaging them with peers as well. Same age children are so motivating to other kids in a way that we try our best to create in the outpatient space, but we just can't. We can't create that magic that happens with the same age peer. And so we encourage our families to engage with other peers, whether that's at library events. Lots of free events happen in our local libraries that are such a great resource. Going to the park, going to the playground, Finding some mommy and me classes are another great place. But we really encourage that engagement with peers. And then reading is so huge. We hear all the time that books have a whole other world in them, and they absolutely do. So not just reading the story as it is. That we can use books and use the same book over and over again to do a million different things. So we can point out pictures, obviously, in the books, but we can also point out actions, point out verbs. Oh, look, she is drinking. He is running. Talking about adjectives. Oh, the dog got wet. This elephant is big. It's bumpy. And modeling lots and lots of different language. We can also start to ask questions. I know at this age, they are not responding to those questions, but kids are sponges. They are taking everything in. So we can ask questions about the story. We can maybe relate it to self. So if we're reading a book about going to the zoo, talking about a time you guys went to the zoo. If we're reading a book about going to the beach, talking about a time you guys went to the beach. And using it for a lot more language modeling, like we've been talking about. If your kiddo is not quite engaging in long periods of time yet, that's okay. We can go fast through those books. We can pick a small book with 1 to 2 pictures. Another thing I encourage my family is you don't have to read the story as it is. You can just 1 word per page: elephant, dog, pig, and making it fast, but just showing them this is how we engage with a book, the turning of the pages, the getting to the end, maybe saying like all done at the end, and getting through that routine and showing them what that book reading routine looks like. Board books are super fun. Alyssa earlier talked about the polka dot books. Those are super fun. If I have a kiddo who is having a hard time engaging in that book reading, adding that tactile element to it, I find really helps. So the polka dot book or the touch and feel books, help get them a little bit more engaged if they're having a hard time. And then, as I've talked about throughout, some strategies that we can help promote language development at this age: talking to them all day, narrating their life, modeling that language all day, every day, as much as you can. Respond to your child. Again, at this age, they're starting to babble and explore with their words. So, just responding to them and pretending that you understand what they're saying and validating what they're saying, because to them, they are fully saying something and it means something to them. So validating their attempts, helping them feel seen and heard is going to go a long time. Utilizing wait time is huge. Just giving them an extra second to process. If you say something to them, if you ask them a question, just give it a pause, give them a moment for them to soak it in, and then continuing on. We don't want to, while we do want to narrate all of the time, we want to make sure that we're not bombarding them. We're giving them a moment to like take a break, take it in, and then keep going. Offering choices to them is also huge. I'm sure this happens a lot every day, but one thing that I show my families in therapy that might look different from what you're doing, if we're offering a choice, we have one in one hand, one in the other, I will hold it out of what I call the grab zone, so they can't grab it out of my hands. And then it gives me another opportunity to model language. So if we have, I don't know, grapes and cheese as a snack option, they'll probably just reach towards one, and then I can model cheese. Great choice. Here you go. Using simple language, not making it too crazy complex, but we are still encouraging adult-like language. We don't want to use what we call baby talk. And then auditory bombardment is exactly as it sounds, just giving them a lot of input all day, every day, so they can hear and then hopefully practice those things that they're hearing as well. Baby sign language is also a great thing to utilize if you have the time and the opportunity. Even just a few simple words. It helps reduce frustration. It gives them another way to communicate with us. So instead of, if they're not able to say these words yet, they might be able to say it with their hands. One thing to consider is speech is a very complex process. We have to involve not just our brain, our articulators, our mouth, our tongue, our teeth, our voice, our vocal folds where we phonate, with our breathing and the diaphragm, then helping our lungs. It's a lot to coordinate at once versus sign language. It's just our arms and our hands and our fingers. So it's a little bit less complex of a process. And that's why we see babies so successful with it. So some easy signs: the hands together for more. This is a pretty common one. Throwing your hands away, kind of, all done. Another one, I see a lot of families using is milk, just kind of closing your hand with your thumb up, milk. Help is thumbs up on your palm going up, help. And a couple other ones they have displayed here. Eat is just your closed hand to the mouth. Eat. Drink is you pretend like you're drinking a cup, pretty self-explanatory. Mine, you just tap your chest. Mine, thank you. We're coming from the chin with an open palm and going down. And then play. We have our Y sign, the letter Y, and you're going up and down. Play. So, oh, and then lastly is please. We have an open palm on our chest and we go in a circle, please. If you'd like to learn, sorry is a closed fist on your chest in a circle. That's sorry. So you can utilize sign language if you choose to. And again, it can reduce that frustration, give your child an opportunity to communicate with you that's outside of verbal speech. And it's just cool to learn too. Okay, so an option that we have is signing up for the Ohio Governor's Imagination Library. So kids from birth to 5 will receive free books. We just got to sign up for that. Another one is, yeah, so this is Ohio's branch of Dolly Parton's Imagination Library. So Dolly Parton started this because she believes, I believe, everybody believes everybody should have access to books. Everybody should have access to these things, no matter who you are, because they're so key for language development, for just overall development with kiddos. And yeah, kids under 3, you can get them under 5, I'm sorry, can get them for free if you just sign up on their website. So that is a phenomenal resource that we have here in Ohio. Any questions regarding speech, language, social emotional skills from the 7 to 12 month age range?